So complex care patients require a great deal of medical intervention. This patient population, which is maybe 5% of the total number of patients, cost almost 50% of the healthcare dollars. And that goes back to the fact that we are perhaps not giving them the right kind of care. So our goal would be to take that 5% of the patient population that costs 50% and maybe make them only cost 30%. And that's a huge impact.
When you look at our patients who have had multiple surgeries, who are on opioids, have multiple complex conditions that have bounced them around from specialty to specialty, if we're actually going to treat these patients, we can't use the systems that we've already had in place. We tried, but they failed.
We wanted to be able to treat on a scalable level and in volume. We wanted to be able to not treat a handful of patients, like a dozen of patients a month. We actually right now treat over 1,000 patients on an ongoing basis each month with our system. There was no healthcare delivery platform or even system that allowed us to do that.
Over 1.7 million people in this country today that are suffering from opioid use disorders, and those numbers are going up every single year. We must do something about it.
Transdisciplinary care focuses on the whole patient. It synthesizes the various specialties together. We understand the whole patient. We're trying to solve not just one problem, but a whole series of problems that in many cases are reinforcing. So what you're doing is you're taking this patient and you're putting them into an environment where they're surrounded by the same healthcare providers and support personnel for a long period of time. You're watching how they are improving, and you're adjusting what you're doing as a group over time.
We can provide better patient care when we have more of the patient's data available to us. So the more I know, the more I can care.
We actually have a transdisciplinary approach to software development. We've made this theme go throughout the entire company. We have a platform where we can focus more on the functionality, the process of patient care, the day-to-day operations, what has to happen, what data needs to be collected.
We moved to a data-driven note creation process where we collect the detailed data through interviews and tests. We can take the data and transform it at real time into the format that the consumer needs.
The fact that the medical providers often don't have access to the information that they outsource makes it very difficult to have a comprehensive and timely way of delivering care.
So the framework is extensible. It allows us to build just about anything that we need. Maybe we need to make sure that a doctor can see a particular patient's record in a specific way. Maybe we need to make sure that a second doctor in a second discipline can see that same record but in a different way. All of those things can be accomplished very quickly with the framework.
The concept of being able to easily get to the data and share that data is built into the framework. So it just makes life a lot easier, especially for our end users who need to see everything together.
We're able to take that 5% of the patients and give them more effective care. It might seem like it's more expensive to do what we do, but in the end it's actually cheaper because you do it right the first time.
If you can create a program that patients love, providers love, costs less, and ensures results, then you've got a ticket. If you can make a program that is reproducible and scalable, in the long run, you've saved the company a lot of money as well. If you make the patients enjoy their time in the program, the no-show rate is going to drop. And if you allow the providers to love what they do in their jobs, there's going to be less provider turnover. So the HR burden is substantially less. All around the board, unitized transdisciplinary care has reshaped the expression of healthcare delivery in our company, and we believe it's going to transform the world.
When a patient comes up to you and says, I tried everything and I have given up, and this program changed my life, then you understand that what you're doing isn't just a numbers game anymore. It's about really taking individuals and changing the way that their life is lived.